So I got a call from a lady about a week ago telling me that she recently got diagnosed with cancer. And she's a single mom. She said she doesn't make any money and she lost her Medicaid. Medicaid sent her notices on why she lost coverage and she just couldn't figure it out how to submit the correct documentation. So she didn't have insurance when she called me. And she had back to back to back doctor appointments booked all throughout September, right? Doctor visits, doing lab work, doing scans, imaging, trying to figure out what's going on with the cancer. She has prescriptions that she has to pick up, and she doesn't have health insurance, right? So there's no way that she can afford any of this. She told me, right? Imagine a single mother with children to take care of, right? She has cancer. All of these doctor appointments coming up. How is she going to afford this? Right? So I felt terrible. So I had to figure out a solution for this. So right off the bat, I said, all right, well, if we look at the health insurance marketplace, they only start plans the first of the month generally. And the next effective date we can get any sort of plan in place would be October 1st, which is, she has doctor appointments scheduled all throughout September. She's not going to have coverage until October 1st. That's not really going to work. So we have to find a solution that can help her get coverage for September. So I said, all right, well, let's look back in your Medicaid, right? I don't typically do this. This is usually out of my scope because I don't usually deal with Medicaid. But because her situation was so dire, I was like, okay, well, I have to help this lady. So I helped this lady log into her Medicaid account, and we just couldn't figure it out, right? The system, it was acting slow on us. They weren't giving us a correct reason on why her Medicaid was canceled. But thankfully, it was about 45 minutes into our phone call. She got a call from Medicaid, which she said, okay, I have to take this. Let me call you back. So I said, okay, of course, take it. So she took the call and she told me what happened after the call. She said that during the call, she was able to find a representative at Medicaid who was able to help her get her plan back in place. So the rep was able to fix it. And when she told me this, I felt so much relief. I was like, wow, this lady was about to go all through September without health insurance, and she just got diagnosed with cancer. She has to provide for her family, right? And I felt this huge sense of relief. It was incredible. So I guess this story does end on a good note. And I really just reflected on this because, I help people with their health insurance every day, but I don't usually come across these dire situations where their health insurance can be life or death. I mean, let's be honest. The health insurance system, the healthcare system in the US, there are so many things wrong with it. There's so many things wrong with it. But for some people, having health insurance can be life or death, right? She wouldn't have been able to pay for those medical bills. She probably would have racked up a ton of medical debt, possibly would have had to go into bankruptcy. And even people with health insurance, though, the statistic is about 76 to 80% of people who file bankruptcy due to medical bills, they still have health insurance, right? But they just can't afford the out-of-pocket costs. And that's really why I believe that understanding health insurance, knowing how to use it correctly, having the right plan can be a lifesaver.